Tori, if you would go ahead, we're going to actually start the official recording right now. So I just want to once again, not invite you because you're here, but welcome you to our web conference today. It is our Prevention Town Hall, Preventing Sexual and Intimate Partner Violence after 1 year of the coronavirus pandemic. My name is Ashley Klein Jimenez, and I'm so happy to be here with you all today. Prevent Connect is a national project of Valor US, formerly known as the California Coalition Against Sexual Assault. Sponsored by the U.S. Centers for Disease Control and Prevention, the views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or Valor. So our plan today, we're trying to get to our guests because they are really who we want to hear from today. But they will be sharing so much about what their journey has looked like over the last year in terms of how COVID-19 has really impacted their violence prevention work. They'll be sharing some examples of how they've been able to make shifts and sustain violence prevention work, and then also share some of the hopes and visions and plans. And we'd love to also hear these from you all as we move through the pandemic, but also its aftermath. And we have done kind of a series over the last year of web conferences really focused on these conversations that we didn't know we were going to need to have, but suddenly we had to have them. And so I will put the link to where you can find all of these resources in the text chat. But we do invite you. We also do have an ongoing COVID-19 series with the National Sexual Violence Resource Center. And so we'll make sure that you have all of that information too. But I want to move on to say that, you know, it was just about a year ago to the week that so much changed. And it doesn't really feel right to host this web conference without acknowledging that. So I really want to invite you all to take a collective breath with me right now. I'm going to breathe. I'm going to take a breath. So take one with me if you feel inclined. And take a moment maybe to just be still and breathe. You know, our guests today are here to share about how their work has shifted over the last year and how they have been able to sustain their work and even celebrate successes. But we also know that there's been so much loss of loved ones, loss of jobs, loss of education, loss of safety. The pandemic has really exacerbated economic and health inequities. And we know that many of these losses and inequities are the direct result of white supremacy and racialized violence that aren't new to the COVID era, but have existed and impacted communities for centuries and are being exacerbated currently. Eradicating racism is part of advancing equity and ending sexual violence. And I invite you to take another breath with me. And I'm going to pass it back to Tori now so we can hear from all of you.
Thanks, Ashley, for that super important grounding as we go into our web conference today and, you know, honor all of those that we've lost before we got here. So things look a lot different now. I think that's an understatement today than they did in March 2020. Before we introduce our guests who are going to share about how their work to prevent violence has changed in the last year, we want to know from you all, how has your work to prevent sexual and intimate partner violence changed for you since March 2020? Ashley's pasted that question in the chat, so please, we welcome you to respond to that. We will highlight some of the responses when in a moment after we've had a chance to hear from some of our guests. We have, for folks who were on when we did our roll call, you can see we have a ton of guests joining us today. I also want to thank the guests who are not listed on here, but who submitted calls for proposal as well. It was great to read about the variety of work that folks are doing to prevent sexual and intimate partner violence during the pandemic. So you'll hear from all of our guests soon. But first, I am excited to introduce our first guest, Rachel Henry. Rachel has worked in sexual and intimate partner violence prevention for over 10 years, beginning as an undergraduate peer educator and currently serving UC Davis as the Education and Outreach Manager, supervising current student educators, bringing her passion for prevention full circle. Rachel holds a Master of Arts in Sexuality Studies from San Francisco State University and a Bachelor of Arts in Psychology from UC Santa Cruz. Rachel, so excited to learn about the work that you've done. Take it away.
Well, good morning, or I guess good afternoon to folks, depending on where you're joining from. I'm thrilled to be kicking it off this morning. My name is Rachel. My pronouns are she, her, her. So just really quick, a little bit about CARE. We are the Center for Advocacy, Resource, and Education. We're a confidential and free service to UC Davis affiliates, student, staff, and faculty who have been impacted in any way by sexual assault, sexual harassment, intimate partner violence, and stalking. We also facilitate a lot of prevention programming and mandatory education for the university. So it's sort of the scope of what we do out of UC Davis. And just to share with you, our primary audience is transitional age youth, ages 18 to 24, particularly our college students. We do have audiences that range outside of this age and sometimes include things like staff and faculty, maybe graduate students older, or sometimes younger students. But this is really our primary focus, which is important to state because what I'm hoping to share with you all today is sort of some lessons learned, things that have been successful for us in adapting to the virtual world, in hopes that maybe some of what I have to share is useful for you to take bits and pieces to implement in your own prevention education. Particularly, we'll be talking about the lens through social media and Instagram as our primary outlet. So that transition to social media, we really thought long and hard about what our priorities needed to be. And our first priority was to establish a marketing approach, and our second was to define our values. And I think that that sounds a lot more expert and in depth than what it really is. Myself and my amazing student team, who are really the drivers behind the work I'm going to be sharing with you today, just did a lot of Googling and a lot of blog reading to sort of gather different tips and tricks to implement some effective change in a virtual environment. So Tori, if you want to click the next 3 slides through. Beautiful. So what's coming up here is 3 different screenshots of our Instagram page. This is just our main page. When you get in, you scroll through. Hopefully right away, you're noticing a trend that's an important key piece of the marketing approach that we've implemented, which is color coding. So the purple is from Domestic Violence Awareness Month. That burgundy is from, I think, September. And then we had blue in December when we sat down and sketched out how we wanted to implement prevention on social media throughout the year. One of the big tips we found was to implement something along these lines, some kind of thematic color scheme, and we went with a different monthly color. So when you open up our Instagram, you can scroll through, you can see which months align with which content. You can very obviously see we usually have anywhere from 12 to 15 posts a month. So we post a few times a week. And there's also a lot of varying visual elements here. So cute little graphics, some aesthetically pleasing visuals, and also intermixing photos of real people, which is another tip that we found that can be an important element of engaging folks consistently through the virtual platform. The second priority here was to define our values. So Tori, if you wouldn't mind clicking through the next 3. Trying to layer the graphics on the page so it's not too overwhelming at once. These 3 different images, these are all from February posts, and each one of these represent one of our 3 values. This was a really key component of what our research found, was that you need to have like a mission and a vision and what it is you're intending to communicate through your social media so that you stay focused on the population you're trying to reach. So our 3 values were to engage, to educate, and to affirm. So this first post you see, how to educate yourself on Black History Documentaries Edition. This was an engagement post. An engagement post is something where we're attempting to engage the audience beyond the couple of seconds that they're looking at the Instagram post. So it would maybe be an advertisement to come to a program or continued learning opportunities that could occur in a slightly more engaging way outside of scrolling on social media. We usually follow these engagement ones up with different Q&As and things like that in our Instagram stories to keep that engagement going. The middle one that you see there is an educational post. The goal of an educational post is that for folks to learn something while they're viewing the post themselves. So whether that's learning more about healthy relationship values or the definition of consent, they're actually gaining direct knowledge just from viewing that post for a few seconds. And the third one is an affirmation post. So our primary target audience is between 18 and 24-year-olds, college students, and we also assume that our primary audience includes more survivors than not. And so providing affirming, empowering posts is really important. These are usually really simplistic but aesthetically pleasing, quick little quotes that feel empowering. These posts do the best for us. And I think that that's because people love to share them to their own stories, to their own social media accounts, which of course just increases traction to ours. So these are the three values. Every single post we create fits into one of these three. So even if you can glance at the really small little tiles in the background, you can see Wear Purple Day. That was an engage post. We were trying to get folks to wear purple and post and engage with us. You can see lots of different affirmation posts. There's a consent educational post, things like that. So this is how we did our primary transition. And we can go ahead and go to the next slide. Sorry, I'm trying to talk a little fast. And the most effective element was really micro learning opportunities. So that marketing piece was how we got people engaged, how we're keeping people engaged. Our numbers and our followers are consistently going up week to week. But we still want to be doing that prevention education beyond just the posts themselves. So if you want to click the next two, Tori. The most successful element of micro learning opportunities that we have found is Reels on Instagram. Reels are 30 seconds or less videos. It was a new element to the platform that Instagram launched to be competitive with TikTok. Late 2020, I think early 2021, they launched it. What we did to create what we call Reels series is that we took curriculum we've already created. So for example, how to be a superhero. That's our bystander intervention workshop. For every 1 to 2 slides in our PowerPoint, we create a 30-second reel. We post a few a week for a couple of weeks in a row. So it's an ongoing series. And by the end of it, folks will have engaged in all the same content that they would have if they had attended a workshop. Of course, there's not like discussion, dialogues, activities, but the information is there. These reels have been gaining thousands of views, which is amazing. It's by far our most successful way in which we are reaching our audience. Micro learning, 30 seconds or less, folks can stay in tune for that long. And then if we want to click 2 more, we also engage a lot on our stories. This is something else new that I have learned about Gen Z is that they love story content on Instagram more than they love permanent posts on Instagram. And so we do a lot of different polls, quizzes, Q&A discussion boxes on our story to keep that engagement going. This is an example of one of those polls. We did a series during Stocking Awareness Month that was sweeter stocking or healthy or unhealthy. And we give folks 24 hours to vote. And then after that 24 hours, we provide just a really brief analysis. You can kind of see there in the corner on why it was either healthy or unhealthy and what would be those values to look to. Another key point about this is that we try to keep the media that we use as examples as new and relevant to our population as possible. So I can think of a lot of really classic examples in violence prevention that I've been using for 10 years now. And several of those, my current Gen Z students have never even heard about. So we really had to spend a lot of time trying to find movies and shows that had released within the last year or two to utilize as examples so that it would be relevant. We can click next. And this is just another quick example of maybe one of the quizzes that we would do. So this was also for Stocking Awareness Month. Folks have the opportunity to vote, and then our next slides always provide explanations. So that's how we've really engaged on social media. We do have a little bit of interactive learning opportunities, but as many of you mentioned in the chat, it's just less, right? People don't want to spend more time on Zoom than they have to. And if we're just lecturing to them via Zoom, it's not the most effective way to provide prevention education. So we do have some non-micro learning opportunities, things that require a longer time investment. And our core value there when we're going to offer more long-term opportunities is that it is engaging above all. It's discussion-based, it's not lecture-based. So on the left, we've got an example of our IG lives. These are anywhere from 15 to 30 minutes. We go live and then we share the videos so folks can reflect back. These still do fairly well. Most of the videos I would say get between 30 and 40 views. And I don't know about y'all, but if I got 30 to 40 students out every time I tried to host a workshop on obstacles to a healthy relationship, I would be thrilled. So when I see that, even though it's not as many views as we're getting on our reels, I still think that that's a sign it's very effective. And we've been able to engage in some really interesting critical dialogues about the intersections of social justice, racial justice, gender equity, and violence prevention through those platforms in particular. And then we also have some other workshops we've done over Zoom. So we've got a sexting and consent workshop that we've done quarterly since last April. That's consistently been really well attended because the reputation is that it's an engaging, interesting workshop. And then we've got our Sexual Citizens discussion series, which has been ongoing. And again, you'll notice these programs are no longer than 50 minutes. They're over Zoom and there's very minimal slides. Sometimes we'll put up definitions or examples to things, but then we stop screen sharing in order to interact and have conversation with the folks who are in attendance. So I know that was like a really big speed version through kind of what we have been doing, and I don't necessarily have a concluding slide to tie it all together, but that is very much sort of the different waves that we've been through in the last year. We have found a lot of success on social media, surprisingly, and a lot of it has to do to the time and labor and energy my students put in, but also just trying different things. And I think if there is any big tip aside from all these specifics of the things that we've done that have been successful is to not be afraid to try out something different. It may or may not work. We don't do as many IG lives anymore as we do reels because they're not as popular, but we're still kind of keeping that diverse mix of different forms of engagement in there, and just constantly trying new things, especially as our tech and our social media continue to advance very quickly as everyone else is also trying to adapt to the virtual environment. So thank you all for 10 minutes to share a little bit about what HARE has been doing at UC Davis.
Thank you so much, Rachel. There are quite a few questions in the chat. And so if you don't mind heading over there and seeing if you have some insight to those questions, that would be great. But I loved hearing about just how thoughtful you all were able to be in growing your social media. I love the concept of defining your values and aligning your posts to meet those. And then I think the use of Reels for microlearning is a really, really cool idea. So thank you so much for sharing, and there's more questions coming in. So if you don't mind heading over there, that would be awesome. Before we go to our next guest, I did just want to say that, a lot has changed for all of you, obviously. Some of the themes I saw coming up in the text chat were, a lot of you shifted work online, but then that also created some accessibility barriers. There was, some of you have to just kind of pause work and reevaluate what you were doing. There's harder to connect with communities, but also knowing that the importance of relationships was maybe even like more so important during this time. And then I saw a couple comments about, people were really just needing basic resources. And so maybe not talking about violence prevention, but helping link them with basic needs that we know will have an impact on that. So thank you all so much for sharing all of that. I do want to introduce you to our next set of guests from Safe Haven Ministries. I want to introduce you to Betsy Uera. Betsy is the bilingual family advocate at Safe Haven Ministries. In this role, she predominantly serves the Hispanic community through outreach, relationship building, advocacy, and crisis intervention. Betsy has a bachelor's degree in international relations and in global development studies from Calvin University. Tara Aday is the Director of Prevention and Education and brings over a decade of experience implementing prevention and intervention-based programming rooted in community organizing and relationship building. And Jared Daniels. Jared is a Chicago transplant to Michigan and is the Violence Prevention Specialist at Safe Haven. He has a passion for books, restorative justice practices, and community accountability. Jared, Tara, Betsy, welcome. I'm going to hand this over to you.
Thank you so much. Like was said, my name is Tara Ade, and we'll be talking today about a particular program, our Gender Equity Reading Initiative. But before I toss it to Jared to talk more about that, Safe Haven is a domestic violence organization located in Grand Rapids, Michigan, more broadly Kent County, Michigan. And so about 650,000 individuals in Kent County. One of the things that I think is not necessarily unique to Safe Haven, but relevant to this conversation is that we're a relatively small organization, but we really have started emphasizing collaboration between our prevention and intervention programming as a way to build relationships in the community. So if you want to go ahead and advance the slide, and then I'll toss it to Jared.
All right, thank you, Tara. Hi, everyone. My name is Jared. And let me tell you about the Gender Equity Reading Initiative, or the GERI, as we have come to affectionately call it for short. This was a program that we developed to help change social norms. In doing so, we were trying to promote alternatives to violence within our community using books and literature, things of that nature. Can you please go to the next slide? So some of the core components of the GERI, which I mentioned, changing those social norms, we're using the books to offer alternatives to violence. And we include in that a span of books reaching from pre-K all the way up to high school level readers. And in doing this, we are trying to reach out to youth, really promoting youth leadership. It is so important for youth to see stories that show characters that look just like them and have similar backgrounds and beliefs as them. In doing so, if a youth can look at a book and say, oh, that's just like my neighborhood, and if that character is just like me, if they can do that, why can't I do that? And then finally, we wanted to make sure that we could empower parents and caregivers, just adults who are working with the youth in their lives. That is so another big important step for the GERI, empowering them to have these ongoing conversations, especially around sexual abuse, domestic violence, and a lot of those other kinds of tough and difficult topics that a lot of parents are kind of just afraid to touch on. And what we do with that is we created a parent toolkit that goes over tips and things on how to talk to your maybe 5-year-old about consent, or touching on things like what to do if your child discloses that they have been sexually abused. We cover all that in our parent toolkit, as well as we offer reading guides for each of the levels, pre-K through 3rd grade, high school, and middle school age levels, to keep that conversation going. We offer questions and extra activities. Next slide, please. And these are just a few of our titles. As you can see in the range they show, we have a few books for those who might be 1st graders, little kiddos, all the way up to Perks of Being a Wallflower for some of our high school students, touching on various topics and characters reaching from all kinds of backgrounds. Next slide. And one big component for us at the GERI is when we created this, we knew that this was going to be very community-based. And unfortunately, like many of us here on the call, when the pandemic really took its toll, so many of our partners unfortunately had to temporarily close, and this had to push us into a very adaptive period. And in doing this, we have been reached out by the Hispanic Center of West Michigan, which is a big community hub for the Latinx community here. And they were doing a food distribution drive. And so we asked if we could take part of that, just distributing some books, because we had heard from parents in the community, they were just kind of missing out on some of that interaction since many of their children had not been in school at that point. And upon doing this, we realized that we already had been there through Betsy, who is on our direct service team. And this showed us that this connection was so crucial. And I'll let Tara talk a little bit more about why our relationships are so important to us.
Yeah, so like Jared had mentioned, really the core reason why we were able to pivot so quickly in the pandemic was we had really, as an agency, said it's not just enough for us as programs to operate in silos, which, to be honest, we had done for a really long time. And we said not only is it going to be important for us to learn how to better collaborate within our organization, but also doing that in the community as well. Actually, could you go ahead and advance the slide too, please? Sorry. And so I'm going to toss it to Betsy again in a second, but it was really because we had intentionally invested in some key relationships in our community that we were able to really say, what's going on in the pandemic? What is the greatest need? And how can we really rely on some of those partners to help make sure that some of our initiatives didn't slow down? So I'll go ahead and toss it to Betsy.
Thank you, Tara. Hi, everybody. My name is Betsy. And as Tara had mentioned, and Jared as well, working with the Hispanic Center of Western Michigan was a big goal of mine personally with direct service, but it also helped us further the prevention and education curriculum and materials such as the Jerry. So before the pandemic hit, I was providing direct services at the Hispanic Center through crisis response, advocacy, and case management, and also working with other partners in the community that worked in schools and in different organizations within that Hispanic community. So when it came time for us to deliver these Jerry books through the food distribution, a lot of the families that were coming were either referrals that like clients that I had referred, or through the Hispanic Center, they had also made it known that these books were going to be distributed. And it was really awesome to see a lot of the families that I had worked with personally feeling comfortable approaching our table and knowing that the material they were going to get was coming from an organization or an agency that they knew and they already had worked with and had already established that trust within that community.
You want to go ahead and advance the slide? Thanks. Did you actually go back one? Sorry.
Awesome. Forward one more right here. Big success. Thank you. So like Betsy was saying, working with the Hispanic Center gave us a chance to really reevaluate and just focus on some of the key things that made Jerry great. And a part of this was we realized that in order to make Jerry more accessible, we switched a lot of our materials over to being virtual, as well as having them translated completely into Spanish. So that way those members in the community had complete access to these materials. Also, our work with the Hispanic Center allowed us to serve 305 families and giving away 200 plus books. These books came in English and Spanish and in a mix of English and Spanish as well. And then finally, because of our work with the Hispanic Center, again, parents were kind of talking about they want some more interactive activities and things to do with their children, because unfortunately at the time, many schools were temporarily closed as well. And this inspired us to create some story times, 4 professionally shot story times, with one being completely done in Spanish. Next slide, please. I'll pass it over back to Betsy.
Thank you. Yeah, so as Jared mentioned, there were a lot of success stories, a lot of numbers that pointed to just how valuable this program was. And some of the stories that I remember specifically from this program, or I guess feedback from families, is number one, the value of having this material offered in Spanish is something that oftentimes with prevention efforts, it isn't always accessible to all families, especially when there's a language barrier. So the fact that not only were our books, that some are right behind me here, that are published in English and Spanish, or a mixture of Spanglish, was really relevant to families and could resonate with some of their experiences. But also the fact that, as Jared had mentioned, our parent toolkit and the reading guide were translated into Spanish was really wonderful, because as children were reading these books on their own or with their parents, the parents had the guides and the toolkits to be able to talk through a lot of these topics, important topics. And one of the stories that I'll share with you all today is about a client of mine who was able to obtain some of these books when she went to the Hispanic Center to pick them up. And she just had such wonderful things to say about the books that were picked out, the fact that it was accessible to her as she does not speak English. But really cool and most important was the fact that a lot of these books introduced her and her son to the conversation around consent, boundaries, respect, and kind of what it looks like and feels like, to have good relationships. And she mentioned how it was so important for her to be able to open up these topics with her son at such a young age, instead of having to wait until he's a young adult or in his teen years, where sometimes these conversations tend to come up either because things happen, or they find, teens can sometimes find themselves in these tough situations dealing with a lot of these topics. So that was a really, really cool success story that we found, is that these books were really helping families open up about these topics with their kids in very age appropriate ways. I think that is all we have.
Thank you all so much. I was going through the website and looking at all of the resources again, and there's just so much appreciation in the chat for the work that you all have done on this, and there's some questions for you. But it's and I love Tara made a comment that this work really helped us learn the importance of not just having intervention services accessible to Latinx communities, but also prevention initiatives. And Betsy, I think that your story really highlights that that these conversations and these concepts are important to all people and all communities. And it's so great that you were able to use your partnerships and your relationship building to be able to advance some of that. So thank you, Betsy, Jared, and Tara. Really appreciate you all. And again, there's some questions for you in the chat. But we also want to hear from you all again. So we have a question. Whoops, I am not pasting the right thing. How are you, or how can you engage new audiences in the work you're doing to prevent sexual and intimate partner violence during the pandemic? So we'd love to hear about any work that you have done to engage new audiences, or any ideas that are maybe rising as you hear what our guests have been doing. So we'll circle back and see what you all had to say, but we'd love to hear from you about that. And at this point, I'll pass it to Tori to introduce our next guest.
Thanks, Ashley, and thank you to Rachel. Thank you, Tara, Jared, and Betsy. Such great information you all were sharing. And Jared and Betsy, I just noticed the books in your background. I love that. Oh, and Tara's got one too. That's awesome. So we are going to move on and introduce our next set of guests, joining us from Women for Afghan Women in New York. Roshni Ahmed was raised in an Indian Muslim immigrant household in New York. At Women for Afghan Women, she advocates for the community's needs and builds community through outreach and programming support with a gender equity lens. Shagufa Ramani, an Afghan-American immigrant woman who has been working as a case manager at Women for Afghan Women for the past 4 years. She's an advocate for women who are survivors and victims of domestic violence and gender-based violence. Roshni and Shagufa, so excited to have you. Let us know what's been going on with y'all.
Thank you so much. We're really grateful to be here, and it's so amazing to hear about all the wonderful initiatives everyone's doing. Before we talk a little bit about how we pivoted during this time, I just wanted to share a brief background about the organization. So Women for Afghan Women is a grassroots civil society organization dedicated to protecting and promoting the rights of women and girls both in Afghanistan and New York. Shagufa and I both work at our New York Community Center, where we provide direct services to Afghan, South Asian, Arab, and Muslim immigrant communities throughout New York, as well as in other states. And we offer a variety of services such as case management for domestic violence, education for adult and youth, as well as legal and other social services. And I'll definitely would love for Shagufa to talk a little more about her casework during this time.
Hi, thank you so much, Roshni, and thank you, Tori. My name is Shagufa. I'm a case manager at Women for Afghan Women. Women for Afghan Women has been providing comprehensive and culturally specific services to the Afghan, South Asian, Muslim women, children, men, and families in New York City since 2003 through our community center. During COVID, when our services, unfortunately, when a lot of places closed in New York and our services all moved virtually, as a person who has been working with survivors of domestic violence, I had so many concerns that I wanted to make sure that we are still able to provide services. My concern was in so many areas. First of all, our community members, especially the clients who I work with, about more than 80% of them are unfortunately domestic violence cases, and they do not read and write even in our own languages, let alone, you know, communicating in English and even navigating the system or even our services through digital devices. We wanted to make sure that they know that our services still was available. So we literally called our clients to let them know that although our office is closed, we are here and we are still available even beyond the regular hours that our office was providing. And that was specifically because of our DV survivors. Culturally, we do live, multi-generation family members live together, and that's part of our culture, that we live with our parents and grandparents, and those of us who are married, we live with our in-laws, and that's culturally. And also in New York City, unfortunately, because of the high cost of New York City apartments, a lot of family members do live in small apartments, and that was a big concern for us in the casework department. We were concerned that are these survivors going to have a safe space to communicate with us? So we offered the services, the hotlines were 24/7, opposed to Monday through Friday from 10 a.m. to 6 p.m. We wanted to make sure that when it's safe for them to call us, sometimes it was a phone call, sometimes it was a voice message through a different app, saying that, hey, I'm here, but I cannot talk right now. So we waited for the clients to call us, and sometimes, it would be late at night, it was on the weekend, but we wanted to make sure that we were here for our survivors to reach out to us. And during this time also, we had to reassess and review and revise our safety planning with our clients, because the scope of our work changed. We weren't in the office. We did not have our community center for our clients to come, and I didn't have my office to sit with them and ask, how to help them. So during this reassessment, we found out that not only our survivors and community members needed a lot of emotional support, they were in deep financial challenges, because unfortunately a lot of our community members lost their jobs. Most of our community members are food vendors, they are restaurant workers, and they are Uber drivers, and they immediately lost their jobs. Literally on March 15, most of them were at home. They weren't working. And because they earn cash, these individuals waited for months until their unemployment benefits kicked in. So when we spoke to the survivors, we realized that most of their husbands, who were unfortunately the abuser, who were unfortunately the breadwinner in the family, they didn't have income anymore. They couldn't pay their rent. Unfortunately, they couldn't even, a lot of them couldn't even buy formulas and diapers for their children. So we really worked hard, and we were so fortunate to provide emergency cash assistance for each family that they were in need, not only throughout our own grants, but we connected them with our partner agencies that we were so lucky and grateful to provide immediate cash assistance until their unemployment benefits started. Not only with the cash assistance, we connected families with halal food delivery that was provided by New York City. We distributed PPE, and that was something that we all remember that receiving masks or even buying a bottle of hand sanitizer. It was really difficult in New York and in April and March of 2020. So we distributed those to family members. We opened our doors and distributed PPE, and if family members couldn't come to pick them up for whatever reason, we delivered it to their doors. We received donations from other agencies, and we delivered those packages to family members, not only to DV survivors, to our seniors, to the youth in the community. And during this time, we also wanted to make sure, so this was all, we realized and noticed that during the reassessment that our family members needed a lot of financial support, besides the emotional support. And this was all to really make sure that we didn't want families to face more barriers and more problems already on top of everything that they were, facing as survivors of DV and sexual assault, because now we wanted to provide this financial support to kind of mitigate and just cause the stress and the aggression that this was also causing within the families. And we didn't want to forget the youth and these the kids that they were living in these households, and unfortunately they were witnessing violence and DV. So our wonderful youth coordinators, leaders, and the entire team also worked really hard, equally provided the same kind of services to the youth. And Roshani, I'm sure will give you some information about that. Thank you.
Yeah, thank you, Shagufa, for talking about some of the different services and ways we pivoted our work. I also wanted to, point out that during this time, it was kind of also an opportunity, given all of the, movements going around surrounding racial justice, for us to better situate the work we do in violence prevention. So kind of just recognizing how, though all people are, vulnerable to sexual and intimate partner violence, there are so many systems of oppression that create vulnerability factors, whether this is race, class, sexuality, lack of English proficiency, and immigration status. That we see often with our community members, which is why we kind of take a holistic approach to provide accessible services, whether that's legal services, and just sort of respond to, these conditions created by our economic and social systems. And also, this was a great time for us to kind of step back and look at perhaps how do we as individuals or community members perpetuate injustice. And we had conversations with our youth, for example, around Black Lives Matter, and how do we kind of discuss these conversations and talk about anti-Blackness within our households. And, a lot of the youth expressed discomfort, especially when you're talking about individuals whose priority is survival. It's really hard sometimes to take stock of what's going on around just getting past, the crises at hand. But we kind of use this space not only to respond to violence, but also, prevent violence systemically. Even with our seniors, sometimes, we find that they may be a little more stubborn in certain attitudes or beliefs, but we were able to have conversations around, what are some of the derogatory terms that we use in our culture to refer to people of different races, and just opening up this line of communication, as well as, using this time to engage civically. We've done a lot of mobilization around the 2020 census with education around voter registration for national, elections. So really this moment allowed us to kind of reckon with how violence prevention, like Tori said, does not happen in a vacuum, but we kind of have to address all the barriers and systems such as racism and poverty to, overcome violence in a very comprehensive manner. But, that's just some of the work we do, and we're really grateful to have so many partner organizations to help us provide all these resources and education.
Yeah, I want to quickly, thank you so much, Roshani, quickly add that Women for Afghan Women is the only Afghan organization in the United States, and the biggest women's rights organization in Afghanistan. All of our work is for DV and gender-based violence in Afghanistan. And here in New York, although we are located in New York City, but our services are nationwide, and our services are all free and confidential, and we offer the services in English, Farsi, Dari, Pashto, Urdu, Hindi, and Arabic on call. And although most of our clients are from Afghanistan and other South Asian communities, but I wanted to say that the services are open for everyone and anyone, and it's for the entire family. Even if I have a client that they come and they speak a language that we do not offer, we never ever turn down a client. We will always connect them with all the wonderful partnership that we have with other organizations to connect clients with them. So I wanted to put it out there. Please, if you know someone who needs our services, we are here. It's not only for women, it's not only for Afghans, it's for everyone. And we would love to help them. Thank you.
Thank you so much, Shagufa and Roshni. It was so great to hear about the work that you all have undertaken in the past year, and also just hearing about your organization as a whole. I know that a lot of preventionists have been concerned about violence happening in the home during a time when people have been so isolated. And so it's so amazing to hear about, how you really look at what the families need holistically, and that you are really able to meet needs of the folks that you work with, especially in terms of economic needs. And then also thank you so much for sharing about the conversations you all have been, wading into and leading in your communities about racial justice. It's a really, just appreciate you sharing that this was something that, you all felt the need, that this was important to build leadership around. So thank you both so much. Lots of appreciation in the text for all of your work and all of your insights and what you shared with us today. So thank you again. I do want to go to our next set of guests. And so we are so lucky to be joined by guests from Líderes Campesinas. We have Elvira Herrera here with us. Elvira is the daughter of farm workers and a former farm worker who started as a member of the Líderes Campesinas adult women chapter in Coachella, California, prior to joining as staff in 2018. A survivor of domestic violence and human trafficking herself, she has been a victim survivor advocate and community activist for more than 23 years. We're also joined by Angela Reed Clavijo. And Angela comes from a biracial and mixed socioeconomic status family. She has been working for improvements to supply chains, social, environmental, and governance structures since 2012. And we're joined by Yesenia Martinez. Yesenia is the daughter of farm workers and a former farm worker whose mother was a member of Líderes Campesinas Kern chapter in California. And Yesenia started as a volunteer for several Kern organizations before joining Líderes Campesinas staff in 2015, first as an organizer and then as a victim survivor advocate. So Yesenia, I'm going to pass it over to you to share about your work.
Hi, hello everyone. My name is Yesenia Martinez. I'm a victim advocate with Líderes Campesinas in the Kern County area. I'm going to go ahead and be presenting what we do in our organization along with my two other colleagues, Elvira Herrera and Angela Greed. So a little bit about Líderes Campesinas is a statewide network of farm worker women and girls committed to personal and community progress in order to address the long-lasting injustice the farm worker community faces. I'm gonna go ahead and share our mission. The mission of Líderes Campesinas is to strengthen the leadership of farm worker women and youth so that together we are the bridge that reach the socioeconomic and political change that ensure our human rights. Next slide, please. So Líderes Campesinas is rooted in the prevention of violence against women, Líderes Campesinas began as Mujeres Mexicanas in the late 80s and early 90s by addressing domestic violence and sexual assault in the fields. The first domestic violence program was in 1995, and the first sexual assault program was in 1997. And here we have a picture of our farm worker agriculture people working in the fields. Next slide, please. So distribution of community design materials. Líderes Campesinas offer a variety of educational topics. Some of our topics we have here are sexual assault, domestic violence, and child sexual abuse. These are some topics we share with our community and farm workers. Also, these brochures that we see here were designed from our voluntary members. Next slide. So distribution of agency community design materials. We have with COVID-19, these brochures are shared via social media, online workshops, Instagram, Facebook, Zoom, everything switched online. We combine the information and the efforts for COVID-19. Next slide. Moving community-led theater skit from in-person to online mediums, including cartoons and arts. Everything went through in-person, through via social. So I'm gonna go ahead and toss the next slide to my colleague, Elvira Herrera.
Hi, thank you everyone. My name is Elvira Herrera, and again with Líderes Campesinas, and here we have adjusted, this is how we have adjusted to do community-led actions and marches outdoors. As you can see, slide 1, before we used to go out and voice our concerns regarding domestic violence and sexual assault. And during the coronavirus, we are doing still the same thing, voicing our concern regarding domestic violence and sexual assault by putting signs on our doors or having someone, you know, talking to the community. Next slide, please. Okay, pre-COVID, but relevant, using technology and including the indigenous perspective. It is important to remember the difference between indigenous and non-indigenous members of the farm working community. In 2019, we made a video in 3 languages on preventing sexual assault in the fields. It was Spanish, Mixteco, English subtitles. To access the video, here is 8 minutes, but we do have warnings that it may trigger, may have some triggers. So we're gonna go ahead and put the link on the chat and see if you guys wanna view that later. Next slide, please. Reaching the community where they are. Before the coronavirus, we go in person meeting with staff and the members, community events like the fields, visits, health fairs, and house meetings. And during the coronavirus, is visiting the fields, food distributions, increased meetings with agencies and governmental officials, including local sheriff departments, courthouse, and district attorney's office. As you can see in one of the slides, that's when we used to go to the park and give out information regarding domestic violence and sexual assault. So now we go out to the fields and give out information as well to the farm working women. Next slide, please. The community testimonies in the news media has increased. Líderes Campesinas has always been very involved with the media, but now it has increased more. As you could see in the first picture here, we have the media that went and they did an article on when we were doing outreach on one of the events. So that has not stopped. It has just increased more. Next slide, please. And the campaigns and arts and exhibits. Some campaigns, but but from in-person online, monthly prevention calls, April and October campaigns, 1 billion rise, some trainings also from in-person online. Líderes Campesinas have this that women, they express what domestic violence is on aprons, and we put that so people could see different type of mentalities or how views of other women, that how they see domestic violence, or their picture, their thoughts, or what they went through on these aprons. But now is they still do the same work, but now, as you see one of the ladies here on the first picture, they're still doing that in bandanas, and they put it on social medias. And as well, one of the pictures here, the little house, one of our members drew that, and she put that as well on social media. Next slide. Okay, and I'll be passing this to my coworker, Angela.
Thank you, Yesenia, and thank you, Elvira. I'm really happy to be here with you too. I know that Elvira and Yesenia do a lot of the on-the-ground work. I'm usually behind a computer, so I'm very happy to be here today with you too. During COVID, well, these are several different realities that are going on. And so my colleague Elvira in Coachella had experienced an increase in calls and cases, whereas my colleague Yesenia in Kern has experienced less calls and cases. And these differences just do show the complex realities of survivors during a pandemic. Just because there are less phone calls or cases in one area does not mean that that is actually the case. A lot of things might be going underreported or not reported at all. And these are all reflections of larger injustices that has been mentioned already prior in other presentations, like the racial and economic ones. It is very clear to us, and a problem that has existed for many years, that in some particular areas there is more opportunity, more education on prevention than in others. And so we do recognize all of those as well. Next slide, please. As a summary, some of the challenges related to this type of work has been less or little or no access to agency spaces and services, difficult and complex online procedures for restraining orders, or no access to computers or printing forms, reduced or access denied to victim advocates in standard court accompaniment or other procedures. And some of the solutions that our team has been doing include advocates playing a larger role, such as completing restraining orders themselves, reminding government officials and security guards on survivors' rights, especially if they're not letting them enter the courts or at other spaces. In some cases, the victim advocates themselves have had to search for safe spaces, and then overall increase the attention 24/7 by the victim advocates. Next slide, please. So prior to COVID, Líderes Campesinas is working very hard to develop stronger ties to governments and agencies. But during COVID, we are trying even harder and doing more. And there has been more responses and also just more intentional meetings. These pictures are from before, but this is also happening during COVID. And I think everyone is realizing that together we can do better work. Next slide, please. This has also meant Líderes Campesinas flexing our advocacy muscles. We sent out 2 letters to the California governor, the first one on April 1st, and it includes 8 issues and recommendations, and number 8 is actually specific to sexual assault, as we were pretty much thinking that cases were going to rise. And so we were asking that more funds be distributed to agencies that will be needing this type of support, and then as well as finding additional spaces for survivors. And then we sent another letter recently in March, but more focused on the vaccines. However, one of my colleagues here, Elvira, told me at an event for the vaccines, there was an argument that was in public between one partner not letting the other partner get the vaccine. And so there are some gender differences there that even affect who gets a vaccine. Next slide, please. That's it for us. This is just a quick way of telling everyone what Líderes Campesinas is about and how we have been working this past year in prevention during the pandemic. Thank you.
Thank you so much, Angela, Elvira, and Yesenia. It's so great. Whenever you all, whenever Líderes Campesinas is able to join on Prevent Connect web conferences, because I feel like you all have such a fantastic model of really bridging the gap between intervention and prevention. The work that you all do to really intentionally meet people where they're at and ensure that people can access both services and both intervention services and prevention services at the same time is really incredible. So I really appreciate you all, going through all of that work, how you meet folks in your community where you're at, and how you advocate for them at the state government level too. It's really inspiring to hear about the work that you all are doing and how you incorporate art into that too. It's really incredible. I appreciate that. So we have one more guest that we want to hear from. Before we introduce her, let's hear from you all and see what ideas you have for how does breaking down the silos between prevention and intervention meet the needs of communities and prevent violence during the COVID-19 pandemic. You've heard from two agencies, a few great examples of how they've done that at Women for Afghan Women and at Líderes Campesinas as well. So just want to see, what's sparking for you all. We know that this work is often very siloed. So what are some ideas and inspiration you have for breaking down some of those silos? And we'll let folks respond to that as we introduce our final guest for today. I'm really honored to introduce Caitlin Burke. Caitlin grew up in Cincinnati, Ohio, and has since worked in the violence prevention field for almost a decade. She became interested in prevention while in college, where she volunteered as a peer educator, and was first introduced to the topic during her mom's career as a SANE sexual assault nurse examiner nurse. She is currently pursuing her master's degree in public health and is an avid baker in her free time. Caitlin, welcome. Let us know what's been happening at the Ohio Alliance to End Sexual Violence.
Thanks, Tori. Hi, everyone. My name is Caitlin. Thank you so much for having me. So I wanted to start off by telling you a little bit about my organization, the Ohio Alliance to End Sexual Violence. So as a coalition, we have a slightly different perspective than those who are doing on the groundwork. We have a more macro perspective. So we are a membership-based anti-sexual assault coalition dedicated to supporting survivors and also ending oppressive systems, practices, and beliefs that support sexual violence. So we work on prevention initiatives and advocate for comprehensive response services for survivors, all through a human rights framework and an anti-oppressive lens. So next slide, please, Tori. So as a statewide organization, the shift to virtual was less of a shock internally than it was for our partner organizations. We are already working virtually around the state. So in Ohio, a lot of our prevention programs are doing classroom-based programming, and our rape prevention education grant is deliverable-based. So this meant that our programs were not going to be able to meet their deliverables as they were originally written. And we didn't want prevention folks to be pushing programming that may not have been the community's priority at the time, which was completely understandable. So we knew that because there was so much uncertainty about how rape crisis centers were going to continue to do their work virtually in general, we needed to quickly bring everyone together and just kind of take a collective breath as we kind of talked about earlier today. So one of my colleagues, Olivia Montgomery, and her fellow LEAP cohort member strategized ways to stay connected during this time of increased virtual world. So from there blossomed our Cultivating Conversations in Crisis series, which is the first graphic there. This still continues today. So these weekly, now turned monthly calls were a space for us to bring together professionals from around the state to build connections and community during this really uncertain time. So from the prevention specific calls came 6 statewide work groups focused on specific pieces of our prevention work, which you see listed here on the right-hand side of the screen. These work groups have been become a crucial way to really connect with prevention professionals around the state, which was something that our specific state was lacking for a while. There was really a need for this connection. And it's really elevated our statewide work. So these groups are developing some really incredible things like statewide toolkits, policy rubrics, and some data collection, which is really exciting. And then lastly, although our policy work isn't always seen as prevention, we're in different teams within the organization, it really is prevention. And so my colleagues really do a fantastic job of advocating for better statewide policies. So our annual Advocacy Day, which is held in April, which was right when everything was happening, pretty fairly quickly changed to virtual, which still allowed for our partner organizations who are doing the work on the ground. They were still able to hold meetings with key legislators on policy considerations like the removal of statute of limitations for rape, Erin's law for sexual abuse, child sexual abuse prevention, and advocate privilege. Next slide, please. So because our prevention programs were so classroom heavy, the pandemic really gave us a push that our state needed to move away from depending so much on classroom education for prevention. We know education is a crucial part of prevention. It's necessary, but it's not sufficient. So in addition to making those statewide connections through the work groups, we also brought in some great training on outer level strategies like Photo Voice and evaluating those outer level activities, which is something that a lot of our member programs were really interested in. So I'll discuss this more in the next slide, but this past year also gave us so many opportunities to talk about how anti-oppression is a key factor in violence prevention, and it really needs to be the core in everything that we do. So our agency has not only been focusing on how to integrate anti-oppression into the work rape crisis centers do, but also how do we incorporate that work internally as well. Next slide, please. All right. So our work as a coalition to ensure local crisis centers are doing the best work possible means that we really need to model how to incorporate anti-oppressive practices within our own organization, and then we can guide others to do the same. So our annual prevention-focused conference, held typically in June, was a really fantastic opportunity for us to hear from some incredible voices who are doing that work. So that included Aisha Shahida Simmons, Dr. Shamara Arki, Camilla Gilbert, and Siraja Rahim. Later in the summer, we brought in incredible training on transformative justice from one of our community partners, Anuj Bandari, that we both provided internally for our staff, and then also as well as separately for our partner organizations. Our statewide working group for white folks who are doing anti-oppression work, the Ohio Co-Conspirators in Ending Oppression, works to ensure we were showing up for the Black, Indigenous, and other people of color in our state. And we are starting this new year more organized and more action focused, which is great. Our policy advocacy shifted to ensure we were speaking out on issues of anti-oppression that weren't necessarily directly tied to sexual violence, like the release of incarcerated individuals during the height of the pandemic. Our prevention technical assistance and training, which is a big part of what we do, continues to involve trainings that ensure our prevention folks truly know how oppression is tied to violence and how to incorporate that into their work. So the pictures that you see here on this slide are just a few examples of the posts that our really fantastic communications team put out. And that's all I have for you today. So thank you so much.
Thank you, Caitlin. You know, I Roshni put the words in my head right in the chat. Really admire the intersectional work that you all are doing. And I think it's really great to hear how you all as a statewide agency were able to do all of this, support your programs, and also be models throughout your state for addressing racial injustice. And making sure that that's not lost in sexual violence prevention, and making those connections beyond sexual violence, and sexual violence prevention too. So really thank you for being here and sharing your work. We're going to invite all of our guests back in just a moment, to answer one final question in our last 10 minutes here. But we want to hear from you all too. We saw a lot of really great responses to our previous question about how folks are breaking down silos between intervention and prevention. Tara mentioning community connectedness is more important now than ever. Anna says collaborate, collaborate, collaborate. Absolutely. And folks also talking about different organizations to get connected to. Leslie Bivens says we need to get faith-based organizations connected. Leslie C says the same thing, connecting with faith-based communities, businesses, salon professionals, etc. So we want to hear from you all. How have you overcome challenges to sexual and intimate partner violence prevention during the pandemic? We know that folks have experienced them, but we also know that we have a really, great wealth of knowledge and wisdom in our audience. So we're going to ask our guests the same question. We want to hear how you all have overcome your challenges as well. But at this point, I am going to welcome back Ashley to kick off our final question to our guests.
Thanks, Tori. And I'm keeping my eye on the chat to see what you all are saying about overcoming challenges and also not knowing or haven't overcome them is a perfectly acceptable answer. So I will keep my eye there, but I did want to go back and just ask, Rachel, I'm going to start with you if you don't mind, and just ask you, do you have maybe one tip for overcoming prevention challenges during the pandemic that you could share with our guests?
Yeah, thank you. I think that the biggest tip that comes to my mind, aside from really focusing on that community collaboration piece that we've been talking about, which I think is really critical to having relationships in this time, is to experiment with trying different things. You might have to try a few different approaches or tactics before you find something that really works for your group. And that's okay. It's okay to try something on, decide it's not working great, and then maybe leave that one in the dust and move forward, or to adapt and change. And that's really how we have found success, is just not being afraid to try new innovative things as we become aware of them, being willing to be wrong, to mess up, to adapt and correct, as we are all continuing to learn and move forward. Yeah, I'm also happy to answer any other questions that may have come up. I think I got through everyone in the chat, but if I did miss you, please feel free to reach out to me directly. I would be happy to follow up on any questions folks might have.
Thanks, Rachel. And yeah, I think that the ability to kind of pivot and adapt is kind of a core component of doing prevention work anytime, but definitely, during the last year and as we move forward. So thank you for that. I want to ask our friends at Safe Haven, what about you all? What is a tip that you have for overcoming prevention challenges?
I'll kind of build off of what Rachel said. So Safe Haven's about a $1.5 million organization. So we're not horribly large, but yeah, we still have a great budget. And our Gender Equity Reading Initiative was the first grant we've ever received that came through the federal government and even the state government. And so when we were planning what the Gender Equity Reading Initiative was, we didn't have anything to lose. We were, putting out a brand new application. And so I think it really gave us that ability to just be creative and think innovatively. And I think I'm reminded, even during COVID, that it can be easy in the prevention world to kind of get into autopilot. I know for Safe Haven, that was going into classrooms. That's something we've been doing since the 90s. And I think that just slowing down a little bit and saying, what's something that we can do that really just makes sense to what our community needs right now? And going for it, So yeah, that's my advice. I don't know, Jared or Betsy, if there's anything you all would add.
Yeah, I'll just add on to your point about community. I don't think that the Jerry would be anywhere near successful as it has been if we didn't listen to our community, if we didn't put people and their needs first in all this. We listened to what our community asked of us, and we did our very best to give back what they required. So.
Thank you so much, Jared and Tara. Betsy, did you have anything to add?
I think we've talked about it throughout. Other folks have mentioned it too, but I think the importance of working across programming within an agency, we've found really great success with Jerry with being able to include direct service staff as part of, even different programs within Jerry. So I think that's something that I would strongly suggest that people not be afraid to work with across programming and being able to bring prevention into these other programs such as intervention and crisis response.
That's great. Thank you all so much. Roshni and Shagufa, I want to ask you, do you have a tip for overcoming prevention challenges?
One thing that I think we've found a lot of, in order to overcome some of the challenges, just like everyone's been saying, is really kind of being flexible, and knowing that, even if something doesn't go as planned, I think as long as we're still connected to the community in any shape or form, that's a really big success because especially with a lot of our community members that were not maybe super comfortable with online technology, we really had to, for example, with our seniors, in order to continue their programming online, we had to meet with some of them one-on-one, install Zoom, and show them how to use it. Instead of just maybe saying, oh, this program might not even happen anymore because they're seniors, they're not digitally literate, but trying everything, I guess, in our means to make sure that connection stays there was really, really important. And, as you saw in some of the pictures, doing like gift basket drop off, just to be able to see them and for them to see us, even if we can't, share the same space. I don't know, Shagufa has maybe something to add.
Thank you, Roshni. Yeah, I agree with Roshni. And also for me as someone who's working with survivors, especially, just being flexible and being patient, because especially during COVID, because we weren't able to see each other face to face, a lot has happened, and just being patient and meet them where they are. Be patient. That's so many times we had to like reassess, revise, and plan again. This is something that survivors go through when they are in a challenging situation. It is really difficult for them to make a decision and stay with that. So to just be there and let them know that it is okay that they are feeling that way, that it's okay that they know what decision to make, and tell them that I'm here to support you, that I'm ready when you're ready. I think that goes a long way.
Thank you so much to both of you. I want to ask Angela, Elvira, and Yesenia, do you have a tip for overcoming prevention challenges?
Elvira, Yesenia, you want to start off?
Yeah. Well, I'll go ahead and speak about what I wish I could have found back in the days when I was going through all this. Patience, because I wish someone would have patience when I was confused. Understanding, not judging anyone. And like someone mentioned, just let them know, hey, I'm here for you. Doesn't matter how long it takes. Trust me, I have waited for some clients over a year to decide to leave. But to me, my key is always to be there for them. Make sure they know I'm still there. It doesn't matter how long it's gonna take you. I'm still here for you. So to me, it will be patience, understanding, and never judge them, not give up on anyone. That's how I feel. Like and this is what I put to practice all the time. Never give up on anyone that is going through this. but always making sure that they know, hey, I'm here. I ain't going nowhere. I know Yesenia
Thank
wants to
you.
add something. Thank you.
Well, during COVID, well, before COVID, we had so many cases here in Kern County, and during COVID, our cases went down. But there's a lot of work out there that we have to do, and like my colleague Anita said, the trust. It's important, the trust.
Yeah,
Thanks, Yesenia.
oh yeah. I was just gonna call out the trust word again with Yesenia, and you know, we're here we're in California, but if líderes campesinas can help with agencies gain that trust, I think that's key. It takes a lot of work and it takes years, but I do think working with the CBOs and the agencies together can make quite a bit of progress. So thanks everyone.
Great. Thanks, Angela. And Caitlin, in our last minute, do you have a tip for overcoming prevention challenges?
Yeah, so my fellow panelists did a great job of checking everything that I pretty much had on my list. But I really would just reiterate that we had a lot of success during this pandemic when we came together. So we're on the same ocean of just stuff that's happening right now. And if we can come together and say, how can we work on this together, that really gave us some success. So yeah, thank you for having me.
That's great. Thank you so much, Caitlin. And thanks to all of you for joining us today, for sharing in the chat with us. I think a big theme of today is really that, you know, community connection and connection to one another, and relationship building is so important no matter, you know, what we're facing when it comes to creating environments that are safe and supportive for people. So just again, Tori, I'll bring you back into this to thank our wonderful presenters. Gosh, you all did such an amazing job. And again, thank you to our audience. Tori, I'll pass it to you for a final closing.
Thanks, Ashley. To all of our presenters, thank you so much for sharing your passion and your inspiration. Sitting here with chills and just really grateful that that you all are continuing to do the work that you do, and that you were willing to share it on our web conference today. So really, really appreciate having you all. Thank you to our audience for being engaged and conversing with us in the chat, and for showing up today. Thank you to our captioners for providing captioning services, and thank you to my fearless colleague and co-host, Ashley Klein-Jimenez. This has been another great Prevent Connect web conference. We hope to see you all on the next one. Take care. Have a great day. This concludes today's web conference.